Sure. Welcome to RPM Squared, where podiatrists on the move, trying to keep things revved up here, however you want to say it, in this crazy time that's going on. We're just four podiatrists: Rob Cananello, Paul Langer, Matt Word, and Michael Chin from different parts of the country, and trying to be topical and trying to share some of our experiences of how we treat patients in our practice. Obviously, last week we talked a lot about what's going on during this whole COVID-19 experience, being physicians and clinicians, and we're trying to evolve with that from there. But so, Dr. Matt Word, you were away during the first week of shelter at home, and now it's your first week back in the clinic. What was it like this past week?
Boy, I gotta say this week was unlike any week I've ever had in my going on 25 years of practice. And there's been, there's kind of there's so many things that are coming at you from every different angles, from patients, staff, family, surgery centers, hospitals. We're just kind of trying to process all the information, and then the city and the state, and then obviously the world. Everything is kind of taken just one giant timeout around the world, and it's kind of given us a little time to reflect on things. But so I was out of the office last week for our spring break, which if you didn't watch the last episode, just didn't happen for obvious reasons, but so I did have a number of post-op patients Monday morning, my first day back in the office after this all kind of blew up. And first patient was a MRI review that she didn't want to come in, so on the fly we figured out how to hook up a telemedicine meeting with that patient. FaceTime on a phone. That was the quickest, easiest way to do it. And there's probably going to be a discussion on how best to do that. But I basically picked up my phone, called the patient in the treatment room, pulled up the MRI films and results, scanned like I would as if the patient was sitting in the office, and reviewed the MRI findings and discussed treatment. So that was my first experience. Another telemedicine patient. Next patient actually had an Android. She was a post-op patient. Couldn't do FaceTime, so one of my staff members had a Samsung. So we ended up kind of on the fly doing that. Now we're at the point now where every room has, we need to have something that the patients can communicate with us with. So we have Zoom hooked up. We have Skype. We don't have MS Teams, but we have, there's another one.
Blue Jeans?
No, the apps, WhatsApp, I guess, WhatsApp. So anyway, the bottom line is we're trying to figure all this out as everything's happening. And, our state, as of 12 o'clock this morning, the state of Florida, completely shut down to non-essential businesses, and that's affecting thing. I went for trying to keep active. This is kind of somewhat of a sports session, so I like to touch on trying to be active, and certainly recommending everyone trying to continue to exercise to keep their immunity up. But anyway, so I went for a usual Friday morning ride. 60, maybe not usual for most people, but a 100K ride this morning. And I finished down at our recreational lake, which is any hour of the day. There's always literally hundreds of people walking, jogging, hiking around this lake. And sure enough, probably 6, 7 different checkpoints on the lake. Chain link fences were set up. There was a Lakeland police. A number of police cars were down there. Anyway, the city shut down. It's probably the biggest recreational lake, and there was police cars on the trail, not allowing people to exercise. But good news, the bike lane's still open. So,
wow.
So okay. There's probably a lot of cyclists. But
So Matt, you bring up a good point. If I could ask, like I know, like a lot of times we give lectures, and I know I've used it in my lecture. I've heard Paul Langer use it in his lecture before too, about how are you dealing with that psychological aspect for yourself personally, and then maybe even for your athletes? How do you handle that, for them?
I'm sorry, you kind of cut off, but I assume you're asking how do you deal with our own stresses that we're having. Is that kind of a nutshell?
No, I'm actually, well, my question is that how do you deal with the psychological aspect for yourself as well as your patients when they're experiencing a loss of not having their usual fitness or athleticism or being able to compete? Like we always say, those losses are sometimes like a death. How do you handle that?
Yeah, huge. And we've had a lot of losses. It seems like every day we're losing our ability to do things that we normally do, right? So I'm, personally, I'm training for a big mountain bike race out in Colorado in Leadville in August, and that requires a lot of training doing mountain bike riding. And every single mountain bike park around us, and I think in the state of Florida, is now closed. So I mean, I can't mountain bike, so it's a real issue for me personally. So I'm obviously doing road biking, but we and I can't work out. All the gyms are closed. So what do you do with that? We set up a home gym in our house. We were lucky to have kind of a little bit of foresight that was coming, and we purchased some stuff from the local Dick's Sporting Goods. We got a squat rack and dumbbells, and we got the whole 9 yards. And everybody's wishing they would have done this 2 weeks ago. But so fortunate enough to kind of relieve some stress and loss of going to your local YMCA or wherever else you go. So making amends or making adjustments to that. So they closed our surgery center, so that was a huge loss. All right, so what do? I've got 20. I think it's up to at least 30 surgeries that I've had scheduled the next few weeks that are now gone. So that's a major loss. Not only obviously financially, that's going to be a big loss, but just not having the ability to treat patients, operate, and keep your skills up. So how do we deal with that? The patients that can be operated on and emergency, basically fracture patients. And I just was at the hospital yesterday. I had an operation on a patient that had a broken bone that we put some internal fixation in. But it's just, and that's a whole nother topic that I'll be glad to talk about my experience at the hospital yesterday. But I think we learned to adapt. I mean, something's got to happen, and it's how you deal with the loss. Do you look at it and kind of pout and say I'm not gonna do anything, or say, all right, I can't do this, what else can I do? And I think that's a good way and I think a lot of the athletes we treat, and I have seen some new patients this week that have had issues that we didn't know was an emergency or not. But so you take our normal athlete, they can't go to the mountain bike park, they can't now go to the lake, they can't do this, they can't go to the gym. So a lot of patients are doing what? They're going out and running and walking, which they've never done. So I've had, I think, 4 stress fractures this week from patients that are overdoing it. They're gung-ho to do something, and now they're going out, and now we've kind of seen some of those. I don't know if that's similar experience that you guys have had, but I think learning to adapt and trying to make the best of a challenging time is, I guess, the short answer.
Yeah. How about you, Michael? What's going on there in Chicagoland?
Yeah, the Lakefront path is still closed. They've had that closed almost for the past week, and I think same thing is that a lot of our runners are social runners, and they get together, or they're social athletic activists, and they like working out together. So you have obviously the psychological aspects of that loss, that it's a piece where people are stress relieving, but they're also getting together to hang out. So it's interesting. Yesterday, and I think I posted it to you guys, is that I'm walking down the street as I'm taking the dog out for a walk, and there's two women who are intoxicated walking around. I'm like, how is it possible that, again, there's literally no one in sight, but then there's two people walking side by side who are, walking with obviously alcohol in their breath. And you could smell it from a distance. It was crazy. So we're trying to keep our distance, from these people, but there's still people who are trying to socialize, which, as I was talking to my daughter just now, trying to go out, and it's beautiful out today. And, it's one of the first days that it's actually feeling like spring, and being able to hang out with her friends. And I'm trying to tell her that you can't. So the losses are, mounting each and every day. And I think what we need to, try to help our patients and also with our family through is just being able to kind of keep our, wits about us, be smart, and certainly, try to keep upbeat. I think Rob, you sent something out too that, how do you you have two sides of the coin, right? You could wallow in this and you could just be, completely upset and just depressed, or you can take it by the horns and do something about it. And I think that's, something that, kind of resonates, that, we can't just sit around, but we also have to be smart, and you have to kind of know the distancing is important. We have to maybe go to the point of, what Paul Halbrow is doing out in the UK, and what they're forcing there is that literally one person goes out of the house and is kind of subject to an hour's worth of time where you can go grocery shopping or you can run errands, and then you're back home. And, I guess just taking information from the places that are actually getting the best improvements and actually applying it to ourselves. So I don't know if that really answered things, but, as far as the depression and the, the feeling down about not being able to work out, I mean, I get it, and we're seeing it obviously firsthand with, people who had races, Boston Marathon, for example, in April, and not being able to do that. They trained pretty much all winter going into obviously the spring, and not being able to run a race now that's being postponed to September. So definitely some things I think we should be on the lookout for. I think there's going to be a huge amount of depression that's going to take place. I think there's going to be a lot of our, runners who are going to gain a lot of weight. They eat the same way. They're, not working out the same. And maybe they're going to start having obviously some other issues just related to the fact that they're putting on more pounds, and they're, lugging that around and trying to then lose it. So I think we're going to be on a situation where we're going to see an upswing in terms of our patient numbers when the isolation and the self-sheltering goes away. So
let's transition on that point right there. So, we're still having patients who want them to go out there, we want them to keep busy, want them to keep moving, want them to exercise. They're going to have injuries. We can't see them, right? We can't put our hands on them. We can't utilize some of the cool things like I have here right next to me. I'll show you, like our shockwave. I have my shockwave machine right here. We can't utilize that right now. So a lot of it is education. A lot of it is old school medicine, right? Telling them to rest, ice, stretch, some of the things that we learned when we first came out of school. But we're losing a big part of like the part that makes us unique as sports medicine docs. So that's the thing I'm finding kind of hard. And I think it's really a time to tune in on our communication skills. How can we relate to the individuals, the things that they need to do? This is not a sports medicine patient, but I'll tell you, I just had this conversation right before I got on with you guys. I had a woman who called, and she's a 50-year-old woman calling for her mother, who's 89 years old. And she said, hey, I just noticed my mother's toenails look really dark. I think she might have a fungus in her toenail. Her mother is in a wheelchair. She's has MS, and the father's 90. So I was on a conference call with all of them. They're like, what do we do about this? I'm like, well, nothing, right now. I mean, and I was like really frustrated having this conversation with them that this is not an emergency thing. That maybe I was trying to be as kind as I can and tell them simple things to do. They're like, well, we'll come in right now. We have masks. I'm like, it doesn't matter. That's not a thing that you need to come out for. So I finally, I didn't know what else to tell this, individuals from the greatest generation. They're tough, they're strong, they're proud to be Americans. And I'm like, all right, imagine this is Vietnam time, and you're in the Viet Cong, and you're walking with your wheelchair and there's bullets flying over you, you're an easy target. So you don't need to come out. We need to have the best people only come out who really need to be, triaged back and forth. And they're like, oh, this is a war. So we really have to make sure it's okay to it's like, okay, I get it. And then the last question he said to me, well, is there another doc I could send him to? I'm like, oh boy. So these are the things that we're trying to deal with here as well. But so it's very frustrating, but I think it's, getting back to some of our basics, of teaching people to stay mobile, to stay strong, to stay flexible, to do self-massage, to get in touch with their body a little bit better, to take time to give themselves recovery days. All those things are so important. And that's I think a skill we're losing. Sometimes it's so easy just to come in and say, all right, let me give you this medication, let me give you this treatment, but maybe it's time to start, being a doctor again.
Yeah.
Yes, sir.
So I'm fortunate in that we have a little home gym set up that we can do some things, but a lot of patients don't. And we've had a lot of patients that have started doing things they never would have done before. And I'm probably going to be one of these patients to try some online yoga, Pilates, some kind of online YouTube things, which a lot of our local yoga studios that are shut down are providing. I think twice a day they're doing like a live yoga, depending, I don't even know the different types that they have, but it's something we're going to try to do, is incorporate some things through a live stream from either a local club or, even going to YouTube and looking up some kind of alternative exercise that you may not have done otherwise. So that may be a benefit. And I know patients are looking for things to do. And if you don't have a bunch of weights sitting around, what are you going to do? You got to make do with something. And, flipping on YouTube and, kind of searching out some alternatives is probably not a bad idea to tell our patients as well.
Absolutely.
Or Peloton. Rob's a Peloton master at this point.
Yeah.
Yeah, well, it's kind of cool. I've been doing Peloton now for a while, but I decided to join this Power Zone Pack, this club that I joined now, and we do every day, and we're trying to reach new goals, and we're kind of helping each other out and rooting each other on, which is kind of fun. And we're doing a Pelofondo this weekend, where we're going to try to do either a 100-mile or a 50-mile bike ride, together, and we're using different classes, and that's kind of fun. You figure out different ways. You have to adapt. Tough times will pass, but we want tough people to continue. So you have to stay tough in what you do. I think that's important.
Yeah,
just one more note on that is I think we are all being looked at for what we do, and I think not realizing little things we do is going to have a very large effect on a number of people, whether it's patients or family. And I think setting a good example on trying to do something like joining a pack or show people that you're doing something is a nice way to try to encourage others to do things as well.
Yeah. And Michael, you brought up a good point before about the eating. It's easy to sit at home and eat and drink and all kind of things, and not that that's the worst thing in the world, but everything in moderation, right? And everything needs to have balance as well. So I think that's okay too. However we deal with our stresses, and it's funny, doing exercise right now for me is the best thing I look forward to every day to deal with the stress. I'm not thinking about anything else but exercise when I'm exercising, which is good.
Yeah. Yeah. Keep the eye on the prize, man.
Yeah. So, Matt, say someone comes to and calls you up though and says they have heel pain right now, and you don't have the opportunity to take an X-ray or do an ultrasound. How are you going to deal with that patient? Because that's a patient you probably see every day, multiple times a day.
Yeah. So I mean, it's not only a great question, but it's pretty pertinent because that's happened a number of times this week from the similar patient that hasn't been exercising. Now they're not working, probably eating a little bit more, wanting, motivated to try to do something. And so they're going out walking the neighborhood or jogging or doing basically doing more activity than they're probably ready to do, and they end up waking up in the morning wondering why their heel hurts and then calling our office. So I think at this point our role is to steer them in a direction we would do same thing in the office without having the benefit of hands-on, not only physical examination, but taking an X-ray or doing a musculoskeletal ultrasound, or applying treatment, whether it's taping an insert, what have you, but certainly walking them through and talking to that patient. And certainly a lot of common conditions like a heel pain is definitely something we can provide quite a bit of information, without actually seeing and examining the patient. And I think, trying to at least get that patient started doing what we would already be doing in the office with the assumption. And again, we tell the patients when we're not physically examining them is, this is what we think's going on. We're not sure without actually seeing an X-ray or doing another test, but for the time being, let's start doing this. And, in the next few weeks, we'll either have a chat or see you back, depending on what's going on in the world. But, and we have, we've got a office educational material that we can either send or fax or take a picture of and shoot to the patient. So that's one more thing that we can do. But it's hard. We've never had to practice without doing the physical exam, right? The physical is a huge part of the exam, and that's taken away. So that's a loss on your examination.
You know what, though? I do find it's been a little bit more beneficial, though, because I'm spending more time talking to the patients, because I'm not worrying about the other 4 patients in the waiting room. This person's got my undivided attention. I'm also giving them more opportunity to say, hey, show me with one finger where it hurts on your foot. Does it hurt here, or does it hurt here, or does it hurt here? And they're showing, no, it hurts right here, doc. Okay. Does it hurt on the other side? No, it hurts right here. Okay, so we're able to break it down a little bit quicker. Then I'll tell them, all right, stand up and show me, can you stand on one foot? Can you do those kind of things? And, so I'm watching them a little bit more intuitively, because I'm missing some of those. It's like if you lose one of your senses, the other ones become a little bit more keen. And I think that's what I'm doing. I'm listening a lot better, and I'm looking a lot more, and I'm making them describe things a lot better. So they're being better historians right now. So I think that's something I'll take moving forward as well afterwards. How about you, Mike? How do you feel about those types of things?
Yeah, I mean, I agree. I mean, you have to kind of use, obviously at this point, probably the actions that you can use, obviously listening and being able to kind of visualize and have the patient kind of, in a sense, perform the exam. But yeah, I do think that you have to kind of ride a little bit more along the lines of what they probably are seeing maybe online as far as treatment options for things like heel pain. I would direct them to the things that I would maybe give out of my office, say, for example, like Curex insoles or FSO compression or night splint, and have them try those things in advance before, having them come in. But I have a patient right now who is actually having to come in. He's developed some, other areas of heel pain he had a stress fracture prior to, seeing us in the calcaneus, but now he's having difficulties actually kind of towards the base of the heel. So what we kind of planned, and I'm still seeing a few patients on Monday, is that we'll have them come in for an X-ray, and then what we'll do is we'll send them out of the office. We're just going to do an X-ray in the office. He'll glove up, mask up, come in, do the X-ray, and then we're going to send him out. And then I'll do the actual visit via telescribe afterwards. So we're going to try to actually get the images. He didn't want to go to the hospital, which I understand, to get X-rays done. And a lot of the freestanding facilities are not available. So we're going to try to do a televisit where I can actually get an X-ray on site and have the exposure be limited. I'm not seeing the patient. We're just doing the X-rays, and then he leaves. And then what we do is get on the phone or teleconference and be able to do that televisit. So his pain just ratcheted up. I mean, he was doing pretty well, and then all of a sudden, I think he started running again. kind of prematurely, and he developed pain elsewhere. That's now like a 7 or 8 on the pain scale. So, but yeah, I think we're using our senses better, and hopefully, being able to give good information, as I think we do. I think we all have a good sense about heel pain or stress fracture. It's telling the patient they need to kind of calm down and chill out a little bit, because they're probably going, 10 times or 100 times the speed now because they have time on their hands.
So what about if you had something as simple and mundane to us that we see on a typical basis, like an ingrown toenail on a distance runner? So now they're saying, I can't run, and this thing, it's not infected so much that they're going to have an issue, but they can't do the things they want to do, and you don't want them doing bathroom surgery to themselves.
Right.
So do you
think
call
you have
that patient in?
I would. I think you have to. I think too that if that does become an infection and they're like, well, the only other option I have is going to the emergency room, they're better served to come to your office than going to the ER. So
I agree with that. Yeah. And Matt, you agree as well?
That's totally the wrong way. No, I'm just kidding. It's individual. But I do agree with it. And that's actually, we just had a little staff meeting here, our Friday afternoon meeting, and we talked about that. Why are we open? There's another clinic in town. Last Monday, they came in, shut their clinic down, fired all their employees, and said, go home. We're not seeing anyone. I don't think that's the right approach, because as Mike alluded to, and what we talk with our staff about, is the big picture is how can we help this whole situation out? Well, where's the biggest problem is going to be not here yet, like it is in New York and I guess in Chicago a little bit, but is we're still going up that curve here in Florida. Our state was just shut down, and it's just a matter of time. There's a whole bunch of outstanding tests that haven't come back, and guaranteed we're going to have a whole bunch more positive results, and it's going to be blown up in the media that there's this giant outbreak where it's already been here. It just hasn't been tested. But so I think the logjam is going to be in our hospital and emergency rooms. And the last thing the ER needs is to see an infected ingrown toenail from a patient that could have been seen in our office. And that's kind of the approach we're taking. We still have all the precautions. We got a sign on the door. We're still waiting on, we've got 2 of the temperature sensor guns that were supposed to come today. They didn't come, but we're gonna start to screen patients with those. We've got.
Matt, can you make a recommendation for other doctors who are listening? Right, what is that temperature gun?
What is it? It's a thermal. So you don't have to actually contact the patient. It's not a thermometer you have to put in the mouth. It's basically, it's almost like a scan, a heat sensing scan.
It's an infrared, and it's got to be like 2 inches away from the patient, so you don't have to physically touch. Yeah, they're very accurate. Better even than the temporal scanners, I think. The ones that you have to put on the forehead and down into the temple.
So I would recommend, at least, there's no best practice because this has never happened in the world before, but I think trying to look at what would be the best practice. And we've had, like I said, we look at other offices. We got a big 200 physician clinic in town. They've furloughed a whole bunch of employees. My hospital experience, which I can tell you a little bit about yesterday. There's some docs that are walking around not only with the N95 mask, goggles on, complete protection at the hospital. It's just, it's a different time we're in now. But like I said, I think if we're able to set a protocol for our staff, keep the physical distancing, which I like that term better than social distancing, because it's a physical distance that you should stay, at least 6 foot away from the patient. But we can still see patients. Obviously, taking precautions, not having family members come with, having the patient wait in the car in the parking lot until we're available. Having less patients in the office. We've got 2 of us in the office, physician-wise, so it's a little more challenging. But we're really trying to limit so that there's really no disruption in the patient flow where there's going to be any interaction between patients or any higher likelihood that they're going to either have something and spread it to us or vice versa, that we're going to have an issue that ends up transmitting to them.
Do you offer the patient a mask as soon as they come in if they don't have one?
We don't do that. And I think the physical distancing is one. If they have we screen if there's any fever, which we're taking their word on it. Once we have the little gun, we'll have an objective finding, and if it's up, they're not going to be here. But we ask them any fever, any cough, any recent travel, which most people are negative. But we've had some patients that have been on cruise ships that we just said it's not the time to see you, and if it is a true emergency, then we do send them to the hospital or to the emergency room.
We had a similar situation, Rob. So we do mask and glove everybody before they come in. I also test my staff, so we take their temp every 4 hours, and usually we're only there morning, so we'll check them in the morning and then check them in at the time that they leave. And I think that's prudent, just because again, if they are potential carriers, I just want to make sure that they're staying home. And sometimes because they are still wanting to work, they're not going to be as honest. And I think that's a big part, is that a lot of people who are having to work to put food on the table for their families, they may not be telling people the honest to God truth. So but we do mask and glove everybody when they come in. So, but we're using droplet masks. We're not giving them N95s, but it's more to kind of keep whatever stuff that they may be carrying in kind of a sequestered space, in their case, a mask, and then gloves, like I said, for each of us. So we started running out of supplies, pretty low. So again, for us, we're going to try and, keep as, low key as possible, like I said, for a handful of patients on Monday. And then after that, just kind of decide, do we have enough supplies to be able to be safe in our office to provide that service?
How about you, Rob?
So we offer masks. They're right there. And some people I have some people come in, look like they're going to fight a fire with all the stuff that they have on, with a hazmat suit. So you have everyone, it's very different. And I had not been wearing a mask because I think the information about masks are still not out. Whether if you're wearing an N95 mask, obviously it's different than if you're wearing just a droplet mask. And even understanding if this is an airborne disease or if it's a surface disease. And I think we're still learning so much about it. Here in New York, we're at this level right now. We're beyond this level, and things are crazy. So the part that frustrates me is that in our practice, we see at least 30 patients every day. And obviously that's been dropped down. So I know that I've been exposed to somebody who's had it, probably, or has someone in their family who's had it. So that's my moral decision that I have a difficult time with. I really do. I want to do everything we just talked about, help all my patients, but I can't honestly say whether or not I know if I am a carrier or not, and none of us can. So right. It's a tough decision.
Unless you get tested. Unless you get tested, but then that raises the issue, why should you get tested young, healthy, no symptoms, when someone that may need the test more than you? And that's kind of the argument, not to get tested.
It's a really tough decision. And listen, let's not fool ourselves. There's also the economic piece that we are all dealing with as physicians and clinicians and business owners as well. Thank God this act is coming out that hopefully maybe we'll be able to keep our doors open. With the CARES Act and PPP, which would be a big help. This way we can really be more prudent in our screening and saying, hey, listen, we don't need to see you. We don't have to worry about us going out of business. Right. But, I think that's an important part of this too. So I applaud the government, which I usually don't do, for doing this. So hopefully that will help us as well.
Yeah, I just got my application submitted this morning. For the PPP, and I think a lot of the groups, the big groups that much like Matt was saying, is that they literally furloughed their whole staff. a big orthopedic group here in the city, and they let like 90% of their staff members go. All the investors in that particular practice divested, so they took their money and they ran. So I mean, there's some obviously different ways of handling it, and I think if we can all kind of be in the same, I think we're all in the same boat. We have people that we really, really, really like as part of our staff, and we want to keep them. And I think by doing, hopefully, what the government is allowing us to do is to be able to take that money and apply it towards the things to keep our businesses alive. So, I think we all have a heart for our staff and certainly for our families and the safety of both. And you want to do what's right. And just seeing and hearing some of these groups just completely folding their operations because they're losing money. They can't perform elective surgeries, and that's a lifeline for their practices, especially orthopedics, that they're at a loss. So all these people are affected by it. Now they're at home, they're on unemployment, and not getting obviously the revenue stream that they would like. So yeah. So the sooner we can get the applications in, I think the better. And when you look at it, the biggest parts are, it's a first come first serve, and you have to put that application in play sooner than later.
Yeah, I would second that, and we put in, we're fortunate we do have at least some emergency to kind of weather the storm, so to speak. But we put in Monday for the EIDL, immediate, and then our application still pending for the PPP. But and I talked about that with our staff, and I would encourage everybody, if you haven't already, I'm sure you've talked to your staff a little bit, but sit down and we all sat down and we actually stayed 6 feet apart. So it was the right way to do it. But we told them, listen, I asked if anyone had any concerns, and some people asked about, and they know what's going on. Their practice in town shut down. All the employees are fired, so they're obviously glad to be here. And I just told them what we know. Nobody knows what this is all going to bring, but the government is, to Rob's point, is doing as much as they can. Now's a time of need when we need to have some reassurance. And I told the staff, every one of you is going to get a $1,200 check. Checks in the mail, right? But we're assuming the check is in the mail. And then if you have a dependent, you're going to get another bonus for that. That's going to help things out. We're trying to maintain our staff at the same level, which so far, knock on wood, we have. And our staff has been great as far as dealing with not knowing what's coming up next, and all these things that we've never had to do, figure out how to hook Skype into or WhatsApp or load everything up and deal with patients that are frustrated. And we actually, we just gave them a little cash bonus, which they probably weren't expecting, but that kind of just shows them, not only now, but in the long term, hey, we've gone through some tough times, but we really do not only say we appreciate your help, but I think that, helps them to realize that we really do, they're not our direct family, but certainly, we feel like everybody works together. And I think that just kind of reassures them, that our intent is to continue practicing and continue to stay open and deal with emergent patients, as we talked about before. So I would recommend just keep that communication channel open.
I think it's amazing. Yeah, I think I might lose some of my staff to Lakeland, Florida. But
come on now, we're giving cash bonuses every Friday.
That's what it sounds like.
I'm coming down there.
Yeah,
we're not hiring
practice.
Right now.
Yeah, I have seven employees, and 6 of them are nursing students. So they're young individuals, they're 20, 22 years old, and most of them are still living at home. And 6 of them have, talked over with their families. They made that decision that they don't feel comfortable coming to work, and I respect that. So, I'm trying to run my practice with me and one other individual, which is not easy, as you can imagine. So I ask patients to be, patient as far as that goes as well.
Yeah.
Excuse me, as a cough.
Check your temperature up.
I know.
So I
Um,
have a question actually for you guys. I have a question for you guys. So I don't know if on alerts that you get, maybe, again, national alerts, but there are alerts that are coming across the phones asking for licensed professionals to provide care in the fight for, again, whether it's in the emergency room facilities or the hospital facilities, and asking for help from licensed professionals to provide care. And I think that, obviously raises some questions as far as, what our skill set is towards, helping in, again, emergency situation for COVID. Is it something that, have you guys had any alerts that have come out? I keep getting alerts on my phone, and it's, I think, put out by the Illinois State Health, or it's IDPH, which is the Illinois Department of Health. And I think they're just hitting everybody's phone. My wife's phone actually keeps going off with this alert. But have you guys come across that at all in the States?
I have.
In your states?
I have, yeah. And to be quite honest, although I'm sure I could serve a role in a hospital, I think what we just talked about before, our role right now is to keep that overflow of those patients from going over there to the emergency room. So I mean, I think if I'm not here, I'm not helping that situation out. So this is what I do best, and I could take care of some of the more minor things, infections, things like that, nail issues, heel pain, instead of them having to go into a hospital. So although I understand where they're coming from, I think that's not my role right now.
Yeah.
Have not, it's funny, kind of it's regional, right? So in Florida, we just shut down our state today. You guys have been shut down for what, week, 2 weeks? So we're kind of seeing what's coming our way, and I think what you're describing is probably coming here. So I haven't had to cross that bridge yet, but I mean, I think Rob's right. Can we do anything? Yes. I mean, they need someone to run a respirator. Never done it, but I'm sure I could figure it out. Not that I'm going to need to do it, but if push comes to shove, I think in a really dire emergent situation, we could do that. But I'm not sure what they're asking you to do or what the alerts are for. But I would certainly entertain looking at it.
Yeah, I mean, the most recent alert is actually coming from the state, and then I started getting emails from the hospital that I'm on staff at, and they said that they're looking for, again, same thing, licensed professionals, people who could aid in the help or aid in the fight. And the hospital actually started putting something out too, that they have compensation packages for those who are helping. So there's a
what are they wanting you to do? What type
they
of
didn't say.
activity, screening, or is it running a respirator? Or?
Yeah, they don't have any details other than you sign up. I think it's one of those. It's it's almost like a draft. You basically put your name in.
You're available if they need it.
Yeah, right. I think it's a roster that they're trying to put together. So
I mean, I think it's fine to sign up, and if it's something you're capable of doing and you're interested in doing it, I wouldn't have a problem. And if it crosses the scope of practice law, I mean, I think there's a push to allow some of that or ease up on some of that during these times.
Yeah.
Yeah, I think especially, I think they're looking, like for us, would be wound healing, things like that, wounds outside of the lower extremity. Be able to help with that.
Yeah.
So, all right, so I want to wrap it up, but I do, I don't want this always to be a coronavirus COVID-19 discussion. We want to move forward as this goes on. So I'm going to, as this goes out to the public, I want the public to reach out to us and give us some thoughts and questions and topics that they want us to talk about. So I'm going to start off, Dr. Rob Coninello at orangetownpodiatry.com. My email is rmconinello. Actually, I'll give you a better one. My email is drrob@orangetownpodiatry.com. drrob@orangetownpodiatry.com. Please send me an email. You can also follow me at O-Town Podiatry on Twitter, as well as on Instagram and on Facebook at Orangetown Podiatry. So feel free to reach out to any of those sources of social media to ask me some questions. Michael and Matt, can you give us your information as well?
Sure. It's Dr. Dr. Chin, CHIN at therunninginstitute.com. And then on Twitter, Instagram, and Facebook, it's The Running Institute. And yeah, feel free to reach out. Any questions, anything that you guys want to hear or talk about. Definitely would be a good way to kind of channel that kind of energy.
And it's Matthew Word, W-E-R-D, FloridaFootAndAnkle.com is a website. We do a Facebook and not really active on Twitter. Probably the most active thing I'm on social media is an exercise app called Strava, which
Yes.
the only kind of quirk to that, and it is one reason why I like it, is because you can't post anything unless you've done something athletic. So if you've done any exercise, you can post, but certainly comment. But I'm on Strava as well. But email, you can send to info@floridafootandAnkle.com. It's info@floridafootandAnkle.com, and I'll that email will eventually get to me and I can respond. But I would certainly like the idea of having a question of the day, and maybe delve into, a pertinent question or someone that has a recurring question that comes up, and then have each of us address from our different perspectives.
Yeah, I want to add to Strava as well for myself. I'm always looking for those thumbs up for this aging athlete. It kind of motivates me to keep on going. So I appreciate that. So without further ado, thank you guys for all of you offer for us. And we'll see you guys next week, hopefully with some good pertinent topics that we could talk about. So stay well, stay healthy, keep laughing, and we'll see you next time.
See ya.
See ya.